Tell RG Bank about your future. They bring us our news, weather, and sports on this Friday morning. It's January 31st. Can you believe it? 1 month into 2025. And it's the fifth Friday of the month, but we're going to feature the Pagosa Springs Medical Center this morning. And they are live and in the house. Dr. Jeremiah Steed, Orthopedic Surgery, and Jason Webb, Director of EMS. Welcome to the show.
Thank you so much for having us this morning.
Yes, and thanks for dropping by. That's awesome. Beautiful morning. It's cold.
It is cold.
Temperature's been dropping.
It's getting colder.
But anyway, we're going to talk about a few things that before the show, you mentioned the Mako Robotics. That sounds really fascinating.
So, it's something I wanted to provide a little bit of information on this morning. Here at Pagosa Springs Medical Center, we now have Mako Smart Robotics, which is really exciting news and kind of what we wanted to spend some time talking about. But it probably doesn't mean a whole lot to people who don't know what Mako Smart Robotics is.
I know. I thought it was some sort of acronym or something.
Yeah, exactly. And
it's shark.
No, it's not an acronym. Mako is the name of a company that made a robot, and it got bought out. But it's been around for over 10 years. But really, it's just growing in popularity and its usefulness to surgeons. And we have it here at Pagosa Springs Medical Center. So what Mako is it is a robotic technology that helps surgeons perform total hip and total knee replacements. It's actually even growing. It's been so successful that they're expanding the platform, and hopefully it's going to be available for shoulder replacements as well. But right now it is used for hip and knee replacements. And I was really blessed with the opportunity all throughout my training of using Mako Robotics. So it's something that I'm very familiar with and really fell in love with even as a resident training. So what Mako allows you to do is it allows you to be really precise and predictable whenever you're performing a total hip or a total knee replacement. And it all starts with a CT scan, and that's really what sets it apart from some of the contenders. Not only is it the first one to come around, but it uses a CT scan. So it starts with a CT scan of a patient-specific joint that is diseased. And what that allows us to do is accurately map out the specific bony anatomy and the specific disease process in that specific patient. That information is then uploaded into Mako software, and we're able to generate a 3D model. And these 3D models are amazing. Like, you can actually see the specific bone spurs in every detail of that specific joint. And it's really powerful because that allows me to actually make a surgical plan that is specific to that patient. So the platform's a little bit different for a knee versus a hip. The hip's maybe a little bit simpler to understand, so I'll kind of talk about it. What it allows me to do is actually plan where I'm going to put the implants and exactly where we're going to resect the diseased bone out so that we can make room for the implants, so that we can reconstruct the hip into the most biomechanical advantageous way for that specific patient. So whenever I talk about how to reconstruct the hip, I'm talking about reconstructing the leg length and reconstructing offset. These are just terms that we use to actually decide where we're going to put the implants, how we're going to fit the cup that goes up into the socket whenever you're doing a total hip. And so it's really, really powerful. I can make all of these small adjustments and figure out the exact right size and the exact right placement for each patient. But it doesn't stop there. The planning is really powerful, but actually intraoperatively, Mako provides a robotic arm that I utilize. I'm operating it, and I utilize it to actually execute that surgical plan that I had spent time creating. And it executes this plan with surprising precision and predictability. And so because of that, I can preserve bone. I can use the smallest implants possible that are still appropriate and not over resect bone, and I can preserve healthy bone. And more importantly, after I have created the cuts for where the implants go on the hip side, I actually can implant those implants with the robotic arm, and so I can put everything at just the right angle that I planned on in the preoperative plan. So it allows me to execute that with really, really amazing precision. It's really exciting.
Mm-hmm. And it seems it's helped with the time that the patient is at the hospital too, right? I mean,
it
just seems, that a lot of this is outpatient work, maybe?
In a lot of institutions it is. There's a lot of moving parts to having an outpatient procedure, all right? It's not just the surgery or the approach. I use the anterior approach to the hip, which also has a big impact on postoperative pain. There have just lots of studies have come out to show that within the first 6 weeks, we're going to use less narcotics. There's going to be less opioid consumption. Patients are going to have less pain. After about 6 weeks, it kind of peters out, and it doesn't show to be superior really than the other approaches to the hip. But who doesn't want to have an easier first 6 weeks after their hip is replaced? So it can definitely shorten hospital stays, and
you mentioned pain. Just today, a new drug has been approved by the Fed, that doesn't have, the narcotic, the kind of dependency effects.
Oh, interesting.
Yeah, so
I'm going to have to look into that.
Just out in the news, yeah. So anyway,
yeah,
it eliminates the risk of addiction and overdose.
Oh, that's fantastic.
So
yeah, I hadn't heard about that yet.
Going on, and pain management too.
Yeah. So that's kind of how it works on the hip side, and a really, really useful tool. That's how it should be looked at. People hear robot and they're like, "So what? Do you push a button and walk out of the room?" And that's not at all how it works. I'm still very engaged. The surgeon still is looking at all the data, making all the decisions, and so you're still dependent on the surgeon being good and knowing what they're doing and actually executing the plan. The robot has the arm, and it has a saw or a reamer on it, but I'm still pulling the trigger, and I'm still executing the surgery, but it just helps me. It helps me to be more precise.
Yeah.
With the hip side, you make all the decisions pretty much before you even go into the operating room. You've completely finished the surgical plan. On the knee side, it's a little bit more complicated because not only are we looking at the patient's bony anatomy that helps us make the decision as to where we need to cut the bone and where we need to put the implants, but there's another variable that's incredibly important on the knee side, and that is the soft tissue envelope. And what I mean by that are the ligaments, the collateral ligaments, the medial and the lateral collateral ligament. You want those ligaments to provide stability to the knee even when you're done. They're going to continue to work. You're going to preserve them. And everybody's ligament is a little bit different. Some people have tight ligaments. Some people have a little bit looser ligaments. And then the disease process can also affect those ligaments, or it does. They can become more contracted, and on other sides, they can become more attenuated or looser. And so that is very important in taking, it's very important to take all that into consideration when you're planning where you're going to put your implants. So on the knee side, you plan the implant size and roughly where the position of the implant's going to be. But then intraoperatively, I actually provide the software with more information by assessing the soft tissue envelope. And I can actually capture this data in real time on how tight the ligaments are. And then once that data is captured, I can actually go back to the surgical plan intraoperatively, and I'm looking up at the computer screen. I'm like, okay, we need to make some adjustments on where we're going to put these implants so that the ligaments have the proper tension when we're finished. And so you have real-time capture of data. You adjust the surgical plan to account for that, and then again we have the robotic arm with a saw on it, and I am able to actually resect the bone using the robotic arm with really, really amazing precision and execute that surgical plan.
So cool.
That is so cool.
And it's pretty cool. And some other things that are really amazing about it is, I'm constantly, even after I resect the bone and I put the implants in place, I'm assessing everything. How does this feel? Does the knee have good range of motion? Is it stable? And if I need to make an adjustment, I can do so really easily. I can tell the software, okay, I want to take another millimeter of bone. That's what we're talking about, like incredible precision. I want to take another millimeter of bone, and so we can actually do that. And you can watch the little saw just move a little bit, a millimeter, and then I perform the cut, and it takes exactly a millimeter, right where I wanted. So I mean, it's a powerful tool. It's really what it should be looked at. It's just another tool in our pocket to be more precise and to be more predictable.
For reference, a millimeter is pretty darn small.
Oh, it's pretty small, all right. Yep. But it can make a difference. It can make a big difference.
That's amazing.
Mm-hmm.
And by the way, Dr. Jeremiah Steed is homegrown, right? You went to Pagosa Springs High School. I meant to do this.
I did. Well, so I was homeschooled, believe it or not.
Okay,
so,
right.
high school's right down the hill there. But I am homegrown. I've been here my whole life. My folks moved here in 1990, I believe, before I was born. They lived in Allison, just south of Bayfield, for a little while. But before I was even one, they had moved here. So this is all I ever knew. And not loving the lack of snow here. It's not what I remember at all.
Yeah, we were talking about next weekend, maybe. We got a storm brewing, hopefully.
Yeah, absolutely. I'm sure hoping.
Right. Well, that's fascinating information about the orthopedic department and the Mako Smart Robotics.
Yeah.
Amazing, really.
and for sure. There's a lot of advantages to it, besides the precision and the reliability. On the hip side especially, you can have a lot less blood loss. And it's kind of technical to explain why that is. Whenever you're doing it without a robot, when you're preparing the socket for the cup, you have to start with a reamer is something that we use to prepare the bone, and you have to start with a small size, and then you gradually work up to the right size. And as you're doing that, and as you're taking a little bit of bone, the bone bleeds. With the Mako, like I was saying, preoperatively, I've decided on an implant size already. I know what the right implant size is because of the CT scan. And so we can put the exact right size in from the very beginning, and I can perform one ream. I'm not coming in and out and slowly increasing the size. I do it one time. And so that can really cut down on blood loss. And that's a huge benefit for patients. They can just recover quicker, and that's less stress nutritionally and on the body, to have to lose less blood. And then I already kind of touched on it. You can preserve bone. Because you have a CT scan and you're making these decisions even before you go into the operating room, you can choose the smallest size implant that is appropriate. And so you're not putting in things that are a little bit bigger than they have to be. And whenever you put in the smaller implant, you can preserve more healthy bone. So it's bone preservation, it's minimizing blood loss, it's accurate placement, and executing that reliably and predictably.
It's pretty incredible, man.
Incredible.
It is.
Thank you, Dr. Jeremiah, for that information.
Yeah, absolutely.
And so we're also curious about the new building, or the old building that's being restored, right? Jason,
yeah, we can talk about that a little bit. So the building that's on the, southwest side of North Pagosa and 160, formerly known as Dr. Pruitt's practice building, that a lot of people who have been in Pagosa for a long time probably know it as.
Oh, yeah.
But anyway, the hospital has acquired that, and there's been a lot of construction activity you may have noticed. But they're getting close to wrapping that up, and the intent of that is to make that a wellness building, and to move some services over there to expand what clinical things we have, clinical services that we have. And so there was a deadline they were trying to get to open it up, but it sounds like they're waiting on some entities to do some final reviews before they can open up that building. But within that, to go with Dr. Steed and, of course, Dr. Webb, who's still doing surgery at the hospital and, to my knowledge, is not planning on slowing down.
He'll appreciate you throwing that in.
Yeah. So we've got two of them now to keep up with. But
right.
With those practices, physical therapy goes a lot with that, rebuilding strength after they've done surgery. And so we're looking at expanding our physical therapy. We've had that service line for a little while, but we've kept it kind of small, and now we're looking at building that so that we can keep up with the surgeons, as well as physical therapy really is a common treatment for a lot of ailments that come up, not necessarily just surgery. So physical therapy is going to be in there. We also have another service line that currently lives in our medical center, which is the interventional pain management, which is performed by our CRNAs, or our, it's like an anesthesiologist, but they go a nursing route to get to their credential. But they're the ones that are essentially doing anesthesia when you're having surgery with Dr. Steed or Dr. Webb. Anyway, they also provide.
Is that Aucoin? No,
is it,
I was trying to think who the doctor is.
Jody, Jody and Brian.
Jody and Brian, that's it. Yeah.
And they're not physicians; they're nurses, but a lot of people view them that way.
Oh, absolutely.
And they study a lot, and I've worked with them many times with patients. They're both very excellent what they do, but they also do interventional pain procedures, and so the clinic is going to be housed inside that building that we were talking about, where they can see people, come up with procedure plans that might help alleviate pain, that might not be a narcotic-driven treatment plan, it's more of a procedural-based treatment plan, or they may, push somebody towards physical therapy, where making the injury stronger may be a treatment. But they have the ability to do a lot of those procedures in the OR, in our OR at the medical center. So both of those are going to be housed currently in that building. They're also planning on doing some educational events there for those that need support groups. Maybe somebody has diabetes, or maybe somebody has a mental health issue that they need a support group that might help them with their treatment. They're going to host those there. We had planned on having the building open, but like I said, we're waiting on a couple last inspections to be completed before we can officially go in there. But that is the plan.
It'll be soon.
If you've been in that building, I walked in it the other day, and it's still under construction zone, but you can't hardly even recognize it from when it was Dr. Pruitt's building. They've done a great job making.
You can almost tell from the outside that something's going on.
Oh yeah, it's very new, and it feels very medicine-like in there now. Not that it didn't before, but it had aged over time, and so they've changed the foot plan a lot. They've made it a little more accessible and easier for people to go in there, and then obviously designed to make these service lines a little more functional. At some point, there is going to be an open house. I think they're waiting to get their occupancy so that they can get in there and start services. But keep your ear out for that open house date. We'll try to promote it as much as possible for those that want to come in and see it. But I'm pretty excited about it, and I know that the administrative team and the board are probably busy planning the next thing that's going to go in there. So there's a whole nother floor to that level right now. It's just the bottom floor is what they've been working on. But I could definitely see future expansion in that building. But we're excited to have Dr. Steed on board, and of course Dr. Webb staying busy, and hopefully that we can take care of people that have injuries here locally here at Pagosa instead of driving somewhere far away.
That's the point for sure. And that's Jason Webb, Director of EMS. And by the way, the hospital owns the EMS and the ambulances and everything, right?
We sure do.
Kind of unique for hospitals.
It's one of the cool things, and to tag it into Dr. Steed's practice and Dr. Webb's practice, this is a very integrated model. There's lots of ways to be able to have one of these physicians in your room taking care of you. One is through the outpatient clinic, which I wanted to throw out, 970-731-3700. If you'd like to see one of our orthopedic surgeons to try to get an appointment to be evaluated in the clinic for an ailment you may have, I'm sure they'd be happy to see you. But the other side of it is if you happen to have kind of a big injury where it kind of debilitates you immediately, our EMS team, which is owned by the hospital, we work within the structure of the hospital, and so we have direct access to get these guys pretty quick. Now, that's not me in the field calling for Dr. Steed, but I'll be calling for the emergency room doctor, and I'll be painting a picture about what type of incident just happened. Maybe you were in a car crash, or maybe you were in a ski incident, or maybe you were in a sledding thing, or maybe you fell in a parking lot. We're letting them know what we're bringing in, and those physicians know what might be needed, and they have direct access to these doctors. So many times, even just yesterday, I saw Dr. Steed in the ER. I was in there talking to one of the physicians, and he was evaluating a patient in the ER. So the EMS system being owned by the hospital makes this happen pretty quick.
The collaboration, the teamwork. Yeah, really.
You may end up with a specialist seeing your injury in the ER pretty darn quick, where there's a lot of organizations where that doesn't happen. There's not capacity to do that. But because we're a small mountain hospital and we own our EMS service and it's all integrated together, it works pretty well.
No, that's a great point.
So I think it's a great thing for sure.
In a lot of places, it's going to take you weeks, maybe months.
Yes.
To see an orthopedic specialist, we're happy and excited to help out as soon as we can.
Right here at home in Pagosa. Fantastic. Let's take a quick break, and then we'll come back and wrap it up with the Pagosa Springs Medical Center here on Good Morning Pagosa. All right, we're back with more Good Morning Pagosa on this last day of January. So Dr. Jeremiah Steed, Orthopedic Surgery, and Jason Webb, Director of EMS, live and local on your hometown radio, Pagosa Springs Medical Center.
Hey.
Wrapping it up, but very interesting show. Thank you so much. Fascinating information from the orthopedic department, and then EMS and Medical Wellness Building. That's coming up, an open house. We'll look forward to that.
Yeah.
what else?
Well, I wanted to throw out too, Dr. Steed, if you liked some of the technical things he was talking about, and that drives interest, or maybe you have an injury that you've been putting up with for a while or something. He does other talks around the community that are where there's a lot of time where he can show slides, and I've been to a couple of them, and they're actually fascinating of the different technologies and approaches to orthopedic injuries, and recommend people go out and see those. And monitor our Facebook page, our website. We try to post those events as much as possible. But yeah, they're super interesting. It's worth giving up an hour or two of your day to come listen to them talk and figure out what you can learn. Also going at the medical center, we've got a couple exciting changes that we've added. Where we're trying to add more service lines. The motto of the hospital is try to get care in the mountains that you love, right here in Pagosa. And when I started here, there was definitely a smaller amount of services, and we've expanded drastically over the last 15 years. And some new ones that I wanted to talk about, there's a couple as well on top of the physical therapy and interventional pain management that we talked about, was pulmonary. We now have a pulmonologist that's working at the hospital, Dr. Holcomb, I believe is his name.
He was on the show last month.
And so those are, pulmonary is a lung doctor, so somebody that specializes in ventilation and breathing. And
at altitude is
yeah, absolutely
a definite issue.
He's a very strong doctor. I know he comes from a great training background. He offers pulmonary function tests. So anybody that has chronic lung diseases, usually every 6 months to a year, you have to do what's called a pulmonary function test. And forever up until now, we've had to drive to go get those. I actually personally get those. So it's kind of cool to be able to get those here at the medical center now and not have to drive away. So he's at the hospital up and running and ready for patients as well. The second one that I wanted to talk about was our neurology services. We've had those for a while. It's been about a week out of the month. We've had a neurologist there in the clinic that's able to see patients, but I believe they've expanded it now due to need. And now I think it's around 2 weeks out of the month. So half the month we have a neurologist on site. All of these service lines that I've talked about, to make an appointment, you just call the main number and follow the prompting. And that number again, 970-731-3700. Then there'll be a call tree, and then it'll route you to the clinic, and that's where you can make appointments to see these specialists that we have here in Pagosa, which is very exciting. And the last thing that I wanted to kind of shout out, our EMS team, as we were alluding to earlier. I don't know if you saw at Ski Joy the last couple, or about a week ago, I think it was, or 2 weeks ago.
Winterfest.
It was a couple days of being pretty darn cold, but we were out there. We had a great event. We were excited to support that event so that Winterfest can continue being what Winterfest is for Pagosa, ever-growing kind of thing, gets us excited for the winter. And right now we're kind of pausing and taking a break until spring break's coming up. That'll be our next thing that we'll be tackling. And it's kind of, as people know, it's like a 3-week event. We have the out-of-towner spring break for the first couple weeks of March, and then the last week is our own school spring break. And the EMS service will be ready to respond to all the stuff that happens when people come to visit, and we're looking forward to it. But we're excited right now to have about a month of hopefully a little bit of lull of traffic and some recoup time.
Right. Yes, exactly. Well, thanks a lot, you guys.
Yes.
Good
Thank
work.
you so much for
And
having us. Appreciate
thanks
it.
for dropping by, and we really appreciate your time and all that's going on at the hospital. You can call the hospital at 970-731-3700. The clinic is open 5 days a week. That's been great.
Yep.
Really like that clinic. And all the primary care physicians and your specialists, like Dr. Steed right here.
That's right.
So fascinating show. Thank you so much. And we'll get to our next segment. Ag News is up next, and we'll think about that snow next week, too.
Right.
Happy
Take care,
thoughts.
Will.
Okay.
Thank you so
See
much.
you, Jason. Dr. Jeremiah, we'll talk to you soon.